When repositioning, be sure, especially in spaces like that, the sheet is at least going over the shoulders, making contact with the top of the table here, okay? You don't have to fully necessarily, but if you had to, this is safer. Just turn them into a ghost. But you want this to be contacting, that way, yeah, the camera's there, nobody can see this way. In enclosed space, you are a little bit safer, but you're better to be extra safe, okay? Then the tenting here is don't lift here at the center like that. Reach across, pin it with one part of your body. So I'm using this leg because then I'm protected in case the their arm flails and they hit me. I can hold across like that, good and strong. And then I just ask her, I'm actually gonna clarify this time. And I tend to use tactile signaling because people will forget what right and left is once the massage brain is there, okay? So I'm gonna have you lay on your left side with your right side up. Okay, go ahead. Now, client did a really good thing just now, scooted down. So if they didn't, I need to say, all right, I need you to scoot down so their head is completely on the table, not on the face grip. And get this out of the way. Get that completely out of the way. You don't need it anymore. Maybe I'll use the pillowcase for something. Next will be my bolster under the leg since I'm standing here. So nice square bolster. And people will get this confused, but same thing, tactile, you can be like top leg is gonna bend forward on top of this. I want this to be where their foot is on the bolster, not hanging off, okay? This doesn't have to be 90 degrees, but it also can't be too much an extension. They'll be more they'll have a tendency to roll forward more, okay? Now, I'd rather the sheet be gathered there up the head, so that's where I can cover the foot like this. All right, now for here at the head, I'm going to actually grab the pillow that's underneath.
I grabbed it.
You already did?
Yep.
Sneaky. All right, now I need to find this corner of sheet. I tend to find this actually standing over here. I'll stand over here, I'll find this corner of the sheet, and I'll have you lift your head up for me, please. And I'll tuck that underneath, okay? Now there's other ways to do this, but we gotta grab that towel too. So with this towel here, I could use the pillowcase to pull this off. I'm gonna show you using the towel, okay? I set this over top first. Then once I have that, I'm gonna ask them to go ahead and bring your arm out from underneath that sheet. And then it's gonna come down on top of the sheet. Okay? And we're good to go. If I wanted to work on the arm, I could. This will become more important when we're working on the side of the body here. In this pattern, since we're working on the arms and I'm working on the arms in prone and supine, I'm not going to work on the arm in sideline. So, and we start here. When you come up near the face, just always re-sanitize. Even if you didn't think it was necessarily, I didn't really work on the feet or anything, but it's just always good practice to get sanitizer on when you're near all the mucous membranes and everything. So, I confirm, all right, comfortable, warm enough, everything good? All right, now, we're working here on the head. Initially, I feel like it might be easier for you to think this two-hand, this whole idea of using your third and fourth digits, so your middle finger and your ring fingers should be your main pressure fingers. Bracket those together, and then stack your hands. And I'm thinking the temporalis muscles. And I can use this, all kinds of good stuff here, thinking the temporalis muscles. As you get more confident, you could start using your palm to do the same thing. There's also the occipital muscles, which are on the occipital bone, not the suboccipital muscles. They're back here. Same thing. Could stack and use fingertips, or eventually could find a way to maybe use my palms. But I have my elbows bent. It's not the best biomechanics. So like I've used this option a ton. I've used this option. It just depends. If there's a quick trick with headache and even jaw pain is to be thorough in temporalis. As well as occipitals, but with the TMJ and stuff, if you want a starting thing to consider, we use this fingertip pressure and ask the client to tell you when you find a tender point. And they can use jaw motions to affect that, okay? All right, so scalp, mobilized. Then we're going to this is why I like just using this towel. Doesn't matter if it's a towel or if it was a big pillowcase, it just makes your life so much easier with the draping and sideline. All right, now warming everything up. Here's soft fist application. Remember, soft fist, you should be able to see all of your fingernails. No closed fist. So it can be like this. Now I'm technically going downhill. Now I'm going across. My wrist is not deviating side to side. Okay? So I'm going to use this. I can glide across like that because I can't use my palm here. I'd rather use my forearm. I could even use soft fist here at the neck. I'm doing this just so you can see better, the camera can see better. I'm going to use my forearm. So holding here, here. A lot of times what I honestly do is I'll hold the sheet right here against the anterior shoulder. So I kind of have like a window. And that's how I work here. And kind of just hold that shoulder so they don't roll forward too much on me. And this is how all these applications go. So I'm warming everything up. I'm not going to knead here. It's silly to try to knead here. So I'm going to warm everything up with the kind of these lighter glides like this, all the way up to the neck. And I'm going to switch back more, thinking upper trap, levator, scapula. I'm going to sink in, tell me when the pressure's just right.
That's good.
Okay, good. There's a good pressure, and I'm more, the force is more into the skeleton, into the upper ribs. And if I step a little bit this way, now I will glide across. I want to make sure I stop before I get really past the most posterior part of the ear. Try to let yourself stop. If you can draw a line from their ear to their shoulder, that's where I need to make sure I stop. It's hard to see that with a forearm, but my forearm application is right there. So then I'm done. And I step, angle my arm so that I'm more posterior, not flat like this. Angle my elbow, flex it, flex the elbow. And I'm here on the cervical, erector spinae. There's some extra muscles back here. Pressure.
Good.
Okay. So static compression, more into the skeleton. And then I switch, and now it's gliding across. Okay, all the way up to kind of what feels like the base of the skull. Pressure.
Good.
Okay. If you have to starting out, do that. Confirm pressure again and again and again. Okay. Here's just where it's a crowd pleaser, so I show it. But a lot of times you can get the neck stuff really good the way I just showed it. You may not need to do more than that. But when I do a thing where it's like a little pull on the traps, use my fingertips to kind of dig into, maybe search for a spot there. A palm will show what my forearm is really trying to do. I'm finding the base of the skull, but then I'm not gonna go and push up into the occipital bone. Okay, I'm gonna find the base of the skull, and then I'm gonna try to sink straight down, not or up, superior, okay? So just what my palm did, my forearm's gonna do. Now I'm just grazing across the skin to make it feel good. So no, very light pressure, basically no pressure, grazing across the skin, grazing across the skin, grazing across the skin, increasing my pressure just a bit. I found the base of the skull. I'm repositioning, changing my elbow angle, all kinds of stuff, and then I'm sinking straight down. Okay, pressure. Okay, good. Anybody remember what a movement I could have a person do here?
Rotate your...
Could rotate your head. What's even more gentle than that?
Lifting your shoulders.
Deep breathe. These are all good. Eyes. The base of the skull, there's a lot of oculomotor reflexes with the suboccipital muscles. So if you want a super safe way to make those muscles engage and disengage, hold pressure here at the suboccipitals. This is for your tension headache people, okay? And have them keep their eyes closed, but roll their eyes around in big circles. Then you don't have to worry about them doing the neck movement thing. I eventually do incorporate that too, but remember eye movements when you're working in many places, but especially in the neck, and most especially in the suboccipital area, can be a very effective way. We have a lot of eye strain with technology and driving and all that kind of stuff. So applying compression and inhibitory pressure to those muscles and then engaging the eye movements kind of resets that whole eye positioning and eye strain related to tension headache. Okay, and good. Now, to get to the lateral side of the body, which is going to be probably one of the areas that frustrates you the most, I have this. I just bring the sheet up where it covers the neck and the chest. Then I can grab the arm, and then I can drape here. So, this area, worst case scenario, go over the sheet. So what I'm trying to visualize here is the scapula, and then there's a muscle called serratus anterior that goes from underneath the scapula over onto the lateral ribs. It's called serratus anterior, but it's really more lateral. Now, if I had to, I can just go over the sheet and do this. But I'm gonna show here. Now this does not have to turn into some big glide, all right? Now one option is hold the arm like this, and then bring your arm in. If they're too rolled forward for us, go ahead and roll forward for me. That's gonna be hard to do, okay? So if she's rolled back and we're squared up, then I'm not gonna reach as much. If she also is too far that way, I may have to ask the client to scoot back this way toward me, okay? All right, great. Forearm. Now, my preference is I do this. Here's my hand. I don't try to do this or anything like that. My hand stays like this, and I can just drop their wrist right there where my thumb is. And that lets this hand be free to kind of control where the scapula, the arm, the shoulder are. So I do it this way. If that's cumbersome, just do it this way. You can also just let the arm lay down on top of you.
Is that more forearm or more elbow?
It's more forearm. I know you have an adaptation, but that's forearm. My elbow right now is right by the contact from the lateral edge of the scapula. So scapula is right there. So my contact's there. That's what I'm feeling for. I'm feeling for the scapula, and I'm trying to nudge it this way into retraction. So my whole goal with the scapula, this is to give you a format to follow. Maybe somebody surprises you, but the scapula should be will be happier most of the time in retraction and depression. So that's what I'm trying to do. Retraction, depression. I'm not even gliding, right? Now it's not a compression down into the skeleton. It has kind of a force behind it, but it's not turning into a glide. There we go. And then to go here, and then down. And that's all it needs to be to start. If something was going on there, they had some scapular related symptoms going on, then we can start looking and searching and be more precise. Okay, the arm's gonna go forward. We cozy them up underneath the towel there. Actually, in this orientation, we might as well actually re-drape that arm. So I'm gonna go ahead and say, go ahead and bring your arm back up underneath that, underneath the sheet. Okay. There. So you see how I was able to use that towel, create all kinds of coverage? Okay. Now here's for the low back. We could have draped for this so we could see it better, all that. If we were gonna work more on the back, I'm gonna do a quick thing on that. If you roll it forward for me, please. This is where we could use the whole soft fist, and that is pulling everything away. So if I needed to work more on the back in general, this is my preferred way. The rectus spinae all the way here. I work on the side closest to the table. Can't have a lot of lotion, so I need a lot of drag. I just apply force right by the spine and then let gravity take me down towards the table. So contact, there's the spine, sink in, let gravity take me towards the table. And then I could make that feel, if I pin this tissue here, that'll create a sensation that everything's being pulled away from the spine, but this is the only hand that's really working. All right? But now I worked on that in prone, and I'm gonna do it here in Sidelying. I'm gonna concentrate on the low back though, because it is her primary symptom area, and it's also neck and shoulders. Low back will be the primary symptoms you're dealing with. So here for the low back, I can't do this force in prone where I can pull everything away from the spine. So low back issues, your best formula is to work on it some in prone, but save time for it in Sidelying. So here I'm more posterior to start, just kind of warming everything up. This is me warming stuff up instead of kneading. Real light glides, working my way more lateral, and I warmed everything up. I'm very lateral now, so now my pressure is going to be, I'm going to be trying to go straight down and cut them in half, trying to go right down into the spine. If I'm on the lateral side, I'm not anywhere near the spine, but that's what I'm visualizing. Okay, pressure. Okay. Here, I know that these muscles, the deepest one being quadratus lumborum, attaches onto the ribs, so this is where breathing would be a good useful thing, as well as neck and shoulders. Right here, good deep breaths. And I just hold that for as long as I feel like I need to. And I could even ask the client, okay, let's compare that spot to these, and you let me know if one feels like it's more a part of your symptom. This one, I had to prompt that, okay? So I went more lateral and I'm gliding everything away from the spine. Then if I'm tactful with this will get easier for you this time. My elbow is going to get as close as I can to the SI joint. And pressure there. How about there? Okay. But that second spot felt like more. Okay. I confirm that. So I go back and I'm going to do one more there. Okay. Good. If I had difficulty working on the hips in prone, then this is where I could work on that. Find the greater trochanter, find the iliac crest, and you're here. You may need that step stool though to get yourself higher up. So if you had to work on the hip here, it's a perfect place, or even the low back area. That's where a step stool like this brings you up high enough to bring your force more straight down, but especially here, allows you to be real thorough and not affect your body mechanics. Cool. Now we're here. Bunch, bunch, bunch. That is a technical term. Client adjusted for me, that's nice, but if she hadn't, then I need to do the same thing of contact. Now it'll be the anterior knee and pull their leg toward me. so I'm not reaching. Okay. Now, as you learn your anatomy, hamstrings track more medially, then we have the adductors. So I'm going to be thinking hamstrings and adductors and the myofascial line between the two. And I applied lotion on myself too quickly, so I wipe it off using the sheet, and then I'm here. The reality is that I contacted a lot of the stuff with my hands in prone and clarified how the connective tissue and everything was doing. Already warmed up a lot of this stuff with the needs and everything. So I have to watch though when I'm showing this that I don't get into my shortcut paths. All right, distribute the lotion. This is where I do kind of, if I ever do like these long swoopy things, it's just for that. It's just for warming up the first layer of tissue, getting that lotion distributed. Then I'm here, I'm gonna stabilize the leg, and if my elbow is flexed more, I'm gonna be more on the hamstrings. So hamstrings, hamstrings. And if I flatten it out and go across, adductors. So hamstrings, adductors. Hamstrings, adductors. Hamstrings, adductors. Okay, redrape, gastrocnemius, still gastrocnemius. Underneath of it, about halfway down the lower leg is when soleus starts. So about there is where soleus. But both of those, as well as plantaris, come together at the Achilles. The Achilles tendon doesn't usually need a lot of pressure right down into it, but what it does tend to help it is bending it away from the underlying structures. Deep to all of those, deep to these big calf muscles that become the Achilles tendon, are muscles that go from, they attach onto the back of the tibia, and they come all the way down between your calcaneus and your medial malleolus into the arch of your foot. So the way that I can affect those is how I could position myself so my palm is oriented well. I could do that with soft fist, which is my tendency. I tend to use soft fist here because I'll kind of set my knuckles in such a way where it's a little bit acting like a wedge in between. But hey, forearms would work too. That would be more broad and gentle, maybe a little bit less specific. Okay, now on to the foot. This is where the only things you want to watch out for with making direct pressure is right into the calcaneus or right into the joint where the metatarsal meets the first phalange, okay? So there's kind of a bony element here we want to be careful of, and here. Everywhere else, you're pretty much good to go. So here it is with the soft fist. But my much preferred tactic is here with the forearm. Here, there. I could be seated, maybe, or down on a knee. That would allow me to have a hill going up. You're never going to beat the forces you're able to introduce to the foot and how you can do it in the sideline. Okay. Squeezes, good. Redrape, heel squeeze, contact. Then I'm over here. Now here's part of the pattern in your map that I actually do not do in my own practice, but you need to get good at draping here. So you saw that. I bunch, I make sure it's contacting the posterior and anterior sides of the leg, and then I can adjust that. We're good. If plant was cold or anything, I can always do all of that. All right. So here really we'd be thinking a little bit of the IT band, but I want to, rather than pressure directly into the IT band down into the skeleton, that'll be ouchy. And some people may like that intensity, but it's a lot. And that's just dense fascia that's not usually accomplishing a whole lot outside of counter irritation. The lines between it, where the quadricep group or the anterior compartment or the hamstrings, the posterior compartment, creating division there is usually what's more needed. So I can knead across. That works pretty good. Arm everything up. And here, glide.
Would you say you have the same pressure on the legs as you do on the back?
Closer, yeah. Sometimes more, sometimes less. The low back, lumbar area is a place where some people really want like probably the most pressure, but that can be comparable to the legs, depending on who you're working with. The athletes, it was like, in many cases, like my max-ish pressure for like the lumbar area and a lot of the legs. That being said, somewhere here, like the IT band, or some spots in the calves, the gastrocnemius, are really tender. So you'll get to a point where like following trigger points, like if they need that intensity, I know how to find it, you know. But that's more of just like they need that counter irritation, or they need that mental component. I've been there where there's something about it needs to feel like it's doing something, right? So there are times when like right now, I'd be more like right on IT band. That's not necessarily hurting anything, but it's a way to at least deliver a lot of sensation. Here, usually what practically actually needs to happen is the IT band needs to get unstuck from the stuff behind it and the stuff in front of it. That's what almost always really needs to occur. In terms of how to actually change the tone of it and create slack for it, let's say it's getting so tight that we're getting lateral knee pain, then we need to come up to the hip flexors and the glutes, because those are the muscles that actually control the tension of it. Now, here, my favorite place to do kneading, because we have an anterior compartment of muscles, we have a lateral compartment of muscles, and we have posterior compartment of muscles. And here's where I can grab a hold of all of those and push on all of these, and I'm basically affecting every single soft tissue element of the lower leg, which is going to be the predominant place where swelling and circulation issues occur. You just can't beat this. The leg's up on the bolster, I have gravity helping me, and I think I can make the sensation of this for the clients that don't want intensity. They want a more light pressure relaxation effect. This is going to feel way less intense than using the forearms on that lower leg, the leg on the bottom of the table here. So if they were flinching and having trouble with you applying pressure on their calves and prone or there for that bottom leg, then come over here and just spend more time doing these knees. So there's the knees. See how big I make those and how slow I make those. Slow it down. Now, another element of how can I incorporate joint movement without even using my hands. All right, I'm pushing the foot and ankle that way with this forearm. Should not look like I'm working hard. So now I'm more lateral. We're on the fibularis or peroneal group. Now I'm more anterior, so tibialis anterior, extensor hallucis, extensor digitorum. Then I'm coming across, now I'm back on the fibularis group. Another way I could introduce this is like this. Do more plantar flexion and dorsiflexion, dorsiflexion, plantar flexion, all of that. Okay, this part, this hand can grab the lateral side of the foot, and this hand can go underneath. If I curl my fingers, that's where I can create a targeted effect, a more point targeted effect. So when people want reflexology from me, I do not do it in supine, I do it like this. So my fingertips can get real precise and focus on all parts of the foot If I was looking at a reflexology chart, I could think like that. I think about the tarsals. I'm like, that's where navicular meets talus. That's where navicular and talus meet cuboid. That's where those stop, and there's some cuneiforms over on this side, and then I'm up onto the metatarsals, and then there's the shearing. So big toe, shear. Next to, shear. Next to, shear. And done. Okay. Next round, we'll go faster. And knee up front, please. Down. I have this to protect. I know where that sheet is. We have the towel already in position. Make sure nothing's stuck. All this can be kind of more flattened out. Good. And then best for you, usually you'll be all right, but best for you to stand behind them and have them reposition. So, okay. I'm going to have you turn onto your other side. Okay. And then pillow in a good spot. And bolster underneath the knee. Okay, foot on the bolster. They are untucked. We're good to go there. I come around. I find the corner of the sheet. Okay, find where the face is. Tuck underneath head. Okay, I'm gonna have you, let me stick you there. Okay, I'm gonna have you bring your arm out on top of that sheet. Okay, good. Done. Sanitizer. Here we go. All right. I'm going to go right into more of just what I do. And I'm going to do way less descriptors. So temporalis, occipitals. The whole scalp is a unit. It's not truly cranial sacral stuff, but I do sometimes think some of those principles. I try to unify as many concepts as I can and think, hey, if they all have the small bit of potential for help, then why not do a little bit of all of it? Good. Okay, warming up the neck. You save your hands 95% of the time, then that means you can incorporate some more like squeezes and stuff like that. I have to save my hands in order to be able to pull off these extra little bits. Okay? So everything's warmed up, no lotion. No, just a little bit of lotion applied. Okay, here is where I can hold the sheet and stuff against the anterior shoulder. Sink in. Pressure. That's good. Good. Hold that wrist relaxed. And then step a little bit more behind them. Cause that to turn a bit more into a glide across. And remember, I already did those pull effects on the upper traps in prone as well. So I don't have to like just do so much in each position. We do it this way. Work on this orientation, this pattern should allow for you to work on the low back and neck and shoulder area 3, if and maybe just 2 times. But it allows you just by that to work on these areas in multiple positions, a little bit in each position, rather than just all in one. There. And swoopy, contact, just light, just letting the shoulder gradient guide me. I'm not applying a lot of pressure. Once I find the base of the skull, now I'm gonna reset where my arm is. Make sure I'm pushing more straight down, big pressure.
Good.
Okay. Roll your eyes, big circles. One direction for a few cycles. And then go ahead and roll in the other direction for a few cycles. Okay, good, relax. Come up. Okay, reposition here. Grab the arm. Here. Drape. Contact. Oh, go and relax. There we go. Okay, this would be a good area. Try to let your arm guys come down. Good. Where while I do this, I could incorporate breathing because I am applying compression on the lateral side of the ribs. That's compressing them actually downward into an exhalated state. So I could just hold here. So you take a big deep breath in and all the way out. Good long exhale. And with that exhale, then I do that retraction depression. That's what the scapula is supposed to do when you exhale. I mean, really, it should just stay there. But when we get into upper chest breathing patterns, we'll start bringing the scapula up into elevation. So big inhale in, and then with the exhale, good long exhale all the way out. Or I could just be moving the scapula around because that seems like the right thing to do. There. There. And good. Okay. Arm forward. Tuck you back in here. Okay. Arm back underneath the sheet. There. Then we're going to get low back. I'm going to show how I do that just over the sheet rather than even draping. It's compression straight down. Now over the sheet doesn't mean I can't still warm stuff up. Rhythmic compression is where I can do a little assessment with the client. Be like, now does that feel closer to the symptom or over here?
The first one.
First one, and then what about here?
Yeah, that does.
Okay, so quick clarification. Then I start introducing pressure. Okay, 10 minutes just right.
Yep.
Okay. A easy muscle energy technique here for all low back stuff. It works in sidelying, pretty much for everything, whether it be lateral to posterior. If I ask her to just start to lift her bottom leg up off the table, tiny bit, hold it. Okay, hold it. Big deep breath. And then with your exhale, let that leg back down. And I'm incorporating two things. A co-contraction there, as well as like shape changes relative to where they attach onto the ribs up here. Okay, again, a little lift with your leg. And big deep breath in. And then all the way out, let the leg back down. It's just, that's a way I can get this stuff to, quote, release more quickly. Okay, and I'm searching. Pressure.
Good.
Okay, more there. Here versus here.
Yeah, there.
Okay. A little lift of the leg. Good, hold. Big breath. All the way out, let it down. Okay, again. Big breath. I figured I did it. Hands that down. Okay, one more. What I'm feeling for and looking for, I don't have to even see it, is how easy did that seem. The leg got easier and easier to lift. Okay. Good. And come down.
What if you know, like, you
Sheesh.
should be doing, you know, some
Scoot.
more things with your client, but your client fell asleep?
Then take that victory. Now you may have to, but that's maybe where, you know what you could do? Here's an actual good answer. An actual good answer to what happens if the client fell asleep, all that. Just do the massage, but keep it a bit more general. Save 5 or 10 minutes at the end when they wake back up, and then you could reposition and do the MET stuff then. That would be but let them sleep. That's the greatest compliment you can get, and that's true parasympathetic dominance. That's the essence of it. So I learned all kinds of ways, which I'm not showing necessarily, like ways to like introduce a lot of joint movement. So one will be, I'll show a little bit here, like for even leg stuff, rather than having them do it. I've figured out ways to do things like this, right? But when you're starting out, boy, do I want you to get better at one thing at a time. You know, learn to do this first, and then we'll work on introducing how to do or use passive movement and stuff like that to maybe get effects when they're unconscious. But yeah, worst case, ideally save the extra time and then just do it at the end. So hamstrings, adductors, hamstrings, and adductors. I'm paying attention a little bit more here because I know relative to kinetic chain and some myofascial sling elements, there may be something related to these proximal hamstrings and how they come up into the sacrum and affect the other side low back. So I'm just guessing, I do feel a little extra tone, but just related to that kinetic chain pattern. That's where I maybe spend a little extra time in some areas. Okay. And hey, worst case scenario, my intention was focused towards that, and that's the way that wherever I'm working, I can be mindfully considering what is their symptom and how can working here affect that. Anytime I can get a hold of the foot and incorporate some movements, the better. Good. Here. I'll be leaning a little bit far forward here. It's just one of my tricks for like having the forces go more medial to lateral, where I let gravity take me kind of down towards their toes. And then if I get down on the knee or I get seated, then I can take all the tissue the other way. Okay. Good. Now, in terms of a pattern to follow to induce parasympathetic dominance, to affect relaxation and stress management, any area where I think I could incorporate breathing, specifically trying to encourage better exhalation versus inhalation, so like what I did for the low back or when I was up on the ribs, all of that. Even when I get over onto the anterior chest in supine, all of that related to how I'm thinking about ways muscles interact regarding upper chest breathing. That's how I could argue I'm affecting stress. Okay? Relaxation, I can think where are areas of the body that have the most sensory input that tend to be the most feel-good areas to work on. Hands, feet, scalp. So in this pattern, I've worked on the feet very thoroughly. The top foot and the bottom foot each get really a thorough bit of massage. So the hands are going to get worked on twice, each foot got worked on twice, and that's the initial argument I can make for how I can affect parasympathetic dominance. The rest should just be that the pacing and the music and the amount of pressure and everything is just right. And you could argue that you were talking about the classic rock music, right?
Yeah, yeah,
You could argue that if you have the wrong music on, person's not going to relax.
you're right.
You know, your pattern could be great, but if you have a sound that is just awful for them, it's not going to be relaxing.
Yeah, it was like, I don't know, my son's all into Spanish right now.
Mm.
So it was like stuff from like La Bamba and all that. But it was like a slower kind of thing. I mean, it was just like, I don't know why this is triggering me, but it is.
Okay?
But not in a bad way. It was
No,
just
well, more
like-
of a good emotional
Yeah.
response.
Yeah.
But, and that would be a good one. Like, that's okay. Like, those kind of nostalgic, whatever, kind of positive, you know, whether it be called a quote emotional release or not, I don't tend to care as long as,
Right.
you know, a person feels safe and everything's all right. People can have little weeps, and that's great. But this is where you can rely a little bit on music. Now, sometimes you'll be in places where you don't have a choice over the music, which kind of was a frustrating thing for me when we got the spa going. Like, we had a speaker system that's over the spa, and then we were trapped in like certain playlists that they only had available and all that kind of stuff. And it is what it is, but believe me, there's some tracks that would really annoy people, you know? So if you can, having some different playlists and even giving your clients some options is a good thing to do. I used a lot of Native American flute music with the athletes, because I could be like, it's about being a warrior. Warriors need to relax too, you know? I don't know. It was like a construct that I leaned into. But you can give them the option. And if they want to listen to some thrash metal, I mean, you have to make sure you can tolerate it too. But if they can go to sleep to
You don't want to do that. It's full measure.
some Megadeth, yeah. But they can go to sleep to some Megadeth, and all the power to them, you know. Now that's usually not going to be the case. I tend to think that things that are a little bit more ambient, in terms of the rhythm, it should be 60 beats per minute or slower is how we induce that response. That's been well studied, even like in mice and everything. So, but something that's more ambient, I like the sound bowls and kind of things like that. But initially for you, it may be nicer to have something that has a bit more syncopation rhythm to it, because then you can cycle into that rhythm, and that can keep how long your applications are. You can synchronize all that. And there's something to be said for how our bodies entrain to music and rhythm, and we do. So if you're hearing that tempo at 60 beats a minute or slower, your body rhythms will start to entrain to that. And if we together do that, then that's also a factor where the rhythm that she's entraining to, if that correlates with the rhythm of the pattern of application, that too will be a way that I could induce parasympathetic dominance more readily. So that's where I really lean into the music. And even lighting. There was always a joke with the pistons and everything. I would go find a lamp and get that, you know, not overhead fluorescent lighting, if possible, is the better thing to do. So, all right.